Hi, it's Warrick Bishop here, or Dr. Warrick. Welcome to my podcast and videocast station. As always, I really genuinely appreciate that you've used your valuable time to tune in, and I hope you find that what I'm producing, the content that I'm sharing, is something that helps you or someone you love with your best medical journey. I feel really quite grateful. This is a great opportunity. I've had Dr. Khanh from the Austin Regenerative Therapy Center in Austin, Texas, joining me already for a podcast where we talked about some of the concepts behind anti-aging, preventing people getting sick, optimizing hormones. It is a fascinating space and it's new. So, first of all, welcome, Dr. Khanh. Thank you for joining me again.
Yes, hello again. Let's do
So,
it.
for those listening, I promised that what we would talk about this time is some of the available therapies or techniques that can be used for this area of anti-aging medicine. Now, we've already touched on hormone replacement therapy, so maybe we start with that just very quickly. Dr. Khanh, when you're seeing someone for hormone replacement therapy, I think you mentioned the hormones you check. Maybe a quick run through on those just as a reminder. Yeah, to set the scene.
Yeah. So typically, uh, people come to see me and they already have an idea that, yeah, maybe my hormones are great. So there's already some awareness. Sometimes not, but most of the time they're aware. So what I start out with is a very comprehensive list of questionnaire, so that I don't miss anything in terms of symptoms. And then, they already have their extensive blood panel. And so we have like a panel for hormone replacement. And I have a more comprehensive blood test. In terms of hormone replacement, we look at, total testosterone, free testosterone, the sex hormone binding globulin, DHDA. We look at the full thyroid panel, including TSH, free T3, free T4, TPO. And then we look at cortisol level, fasting cortisol level. We look at ferritin level, CBC, just the basic metabolic panel to look at the electrolytes, kidney function, liver function as a basic. And then what else? We look at CRP for inflammation. And then we look at homocysteine level. I always check vitamin D level. What else? For women, we look at estrogen, progesterone, FSH, and for men, I forgot to mention that we also look at the metabolic panel, and that include hemoglobin A1C, fasting glucose, and uric acid.
And probably insulin at the same time as well, I'm guessing.
Fasting insulin, right?
Yeah.
Fasting insulin, which is fasting insulin would be if I only have to do one test, that would be the one, actually. Is that important?
My own practice for insulin, those listening in may be aware because I will have spoken about it before, is I regularly use the homeostatic metabolic assessment ratio, which is basically a calculation on fasting insulin and glucose to give some sort of general insight into insulin resistance.
Right, right.
With those tests, Dr. Khanh, for those listening, when would you start to see these changes occurring? And therefore, at what sort of ages should people be starting to think that their hormones might be dropping off? So, for example, at 90 years of age, what percentage
Yeah,
of men might have low testosterone? What percentage of women will have low estrogen, progesterone? Things like that.
yeah. You know, so for human, peak performance is 18 to 25.
Okay.
And so after
Wow.
that, every year is going down.
Wow.
And when you are, past 30, like around mid 30s is when, if you have symptoms, uh, there's role for optimization and of course the selection of which hormone to replace. Even for men, for testosterone, we have, options, and it's very based on age. But we really go by symptoms.
Yeah.
Uh,
Okay.
and we look at the range, but that is just to guide us. Symptom is more important. That drive the decision in terms of what to do and when to do it.
Okay.
And it's really not a question of if somebody should start on hormone replacement. It should be when is the right time to do it. It's not if, in my
And
opinion.
for those listening and for my own education, once you've started hormone replacement therapy, are you pretty committed for the rest of your life? Because if you withdraw it, has the body been turned off? So are you sort of stuck with it forever?
Right. So it's a philosophical question. Uh, there's nothing wrong with accept the normal decline associated with aging. And if you're okay with that, you have the option to do that.
Yeah.
Or if you want to do something, you want to be proactive, and if you want to bring your hormone level to the peak function for human and not push it, to a crazy high supra physiologic level, that's the other option. Now, in terms of once you get started, can you stop, or are you going to be dependent on that? Um, the reality is you can stop when you start, but you're just going to feel bad again. So if you're willing to do that, you can certainly stop. And
Yeah.
what I suggest is, to slowly wean off, and, with age, you're just going to progressively go, less and less. And uh, you can, let's say a 60-year-old male go on to testosterone, feel great, and then decided, hey, I just want to go off. I don't want to be on it. I don't want to be bothered. Yes, they can go off. They're just going to feel bad. And uh, if you want to go back on it again, you can. But I give people options, so it's not like you absolutely cannot. But just knowing that when you get off, you're going to feel worse. And then you're going to lose the protection against multiple medical issues, including heart disease, stroke,
So
dementia.
this would be a conversation that an individual would have with their anti-aging specialist. Let's move past the hormones and let's try and cover some of the different modalities available for anti-aging.
Right.
As we've spoken about, you know that locally here, I'm involved with the delivery of IV vitamins, minerals, chelation, and NAD plus. And for those who haven't heard what NAD plus is, it's really an energy source for the mitochondria to help the cells work as best as possible. So it's giving the cells an energy supply.
Mhm.
Where do you see things like vitamins, minerals, NAD plus, or even chelation fitting into that anti-aging journey, Dr. Khan?
Yeah. So, you know, due to our current uh, environment, the soil is depleted. So the amount of, mineral vitamins in the food that we eat is a lot less. And so, yes, we do measure, and if the level is low, we should have replacement. And, we can do oral supplementation. Uh, and then IV is definitely another modality that is more direct and is, more effective. And I have people that will come regularly to have IV vitamins, NAD, and we have different mixture for immune optimization, for repair recovery. There's different thing, and people my patients before they go on a big trip to Europe, or they will come in and do that, and when they return, they will come back and do that just to get rehydrated and just to get replete with all the minerals that's needed. And then NAD is another source of they kind of need it to feed the mitochondria, and the mitochondria are needed to produce ATP, which is like the currency for energy, right, in our body. So, and with age and with poor health, that NAD level is lower. And so this is an attempt to help to optimize our mitochondria. And mitochondria is kind of like the battery of all cells. And so when that get optimized, then across the board, across all cells, all organs will be optimized. Yeah. So that can be used for energy, for repair recovery, for traumatic brain injury, autoimmune condition. It's just so many things.
And have you seen clinical examples or patient examples where this has made a profound difference for people, Dr. Khanh?
Yes, absolutely. I have multiple, but one story that is really profound. During COVID, I had a fairly young professor that got COVID, and he just became, debilitated, brain fog. He will go for a walk for 15 minutes, and then he have to sleep for hours, just like debilitated. So we did a combination of peptide combination and a series of NAD, and it's really life-changing. And I remember when he came to me, he said, well, in a few months, I have a conference in Europe, and it's an academic conference. I really want to go, but the way it is now, there's no way. And sure thing, I received an email from him, from Europe. He's like, well, I'm here. I'm completely normal and I'm fixed.
Wow.
So and I have to say it's a combination, and that's the theme for what I do. You can do one thing, but the best is to figure out, what's missing, what's suboptimal, and optimize everything to get the best result.
So one of the things you mentioned in that story about that young professor was peptides as well. Well, what is a peptide, and how did you use that for this person?
Yeah. So this is my passion, and I'm an expert in that. And in medicine, as you know, we can't guarantee anything really, but in terms of peptides, I have to say I have the most confidence in, right, in terms of the effectiveness and the benefit. Peptides are small protein. It's a sequence of amino acid. 40 amino acid linked together or less is a peptide. And then a bigger, than that is polypeptides, and then a protein. So what that means is it's natural, it's amino acid, and the body make these peptides. When we talk about peptide therapy, we copy the exact sequence of these peptides, but they are being made in the compounding pharmacy. And so with peptide therapy, I think of that as, what do I want to achieve? And peptides are under different big category, such as repair recovery. There's a big category for immune modulation, And then there's peptides for mitochondria. There's peptide for telomere length. There's peptides for, brain. It's called neuropeptides. So there's just many different categories. And to take that to the next level is sequencing, combining these peptides in a way that it's best for you. Like everyone come in with different situation, and then we have to figure out, okay, what is needed to address first. Because if you use peptide in the wrong sequence, you might get the benefit right away, but then you get burned. Meaning, it's just like, for example, we talk about car analogy. So if we take a sport car without looking at the oil and the engine check, and then you just, floor it and go really fast, it can go fast, but then, it get burned down and get crashed. So the sequence, the when to start what is very important. And and it's very effective.
Okay. Well, look, for those listening, and you're wondering if these peptides are on the fringe of medicine or not, you may well have heard of some very common peptides that are used regularly, and these are the semaglutide tirzepatide type peptides, which you might know as Ozempic or Wegovy or Mounjaro. And so
Right.
these are the weight loss peptides, and a very easy way to understand a peptide, as Dr. Khanh was saying, is it's almost a piece of an active protein. So, for example, testosterone is a protein, but if you imagine that protein floating around the body and then connecting or linking to a cell, that whole protein may just have a reactive end or a particular point within that protein that interacts with the cell receptor. The peptide is just replicating that bit that reacts, not the other stuff. So it is, as Dr. Khanh said,
Right.
natural. We use them a lot. And it sounds
Right.
like there's many available, Dr. Khanh, which is interesting.
And mainly they signal the body to do specific tasks,
Yeah.
as you mentioned. Um, and so we, depending on what outcome or what signal we want, then we use appropriate protein. And insulin is the very first peptide that was, made years ago, and it's life changing.
Yeah, of course.
Yeah, and it'll be amiss to not talk a little bit about the GLP-1, GIP, because everyone talk about that, and there's a lot of misunderstanding about that, because I think GLP-1 is probably one of the best peptide uh, available, and it's beyond weight loss. Um, it is part of the toolbox for cardiovascular protection, for brain protection, for gut protection, and so forth.
Yeah.
And when used appropriately under the right care, meaning you want to monitor closely the your muscle mass and your protein intake, so that we drop the fat and not lose muscle, which is really, really important. And it can be done if it's done correctly, with the correct monitoring, with instruction to tell patients specifically how much protein to eat. And we have to monitor your muscle mass and not just the number on the scale. So that is important. So when it's done right, it's amazing. And then you're not staying on it forever, right? We train patients to eat correctly, to eat the right things, and then once they get to achieve the goal of a healthy body composition, then we can switch that into a preventive low dose. Like somebody have like high risk for heart disease or already have heart disease, low dose GLP-1 is definitely part of the toolbox for that.
Okay. Let's keep skipping through some of the agents that are available. One of the things, because I took an opportunity to look at your website, if anyone's curious, and particularly if you live in Austin, Texas, check out Dr. Uh, Khanh Nguyen's website, which is the Austin Regenerative Therapy Art website. But
Mhm.
there's a whole list of things. One of the things you've got in there is PRP. What is that, Dr. Khanh? What's PRP?
Yes, yes. So PRP stands for platelet-rich plasma, and that is under the category of regenerative therapy, and is using the body's own growth factor to address various conditions. And PRP is mainly first used in the orthopedics world. I'm podcasting. Um, and um, and now we use that for aesthetic, for skin rejuvenation, for hair rejuvenation, for sexual optimization, using the same principle. It's under a category called biologic, meaning it's just a natural uh, option to help the body to repair and regenerate. And under that category, PRP is kind of like the foundation. And then we also have young plasma, which
Yeah.
is the plasma from healthy donor age 18 to 25. And that is proven to be a lot more potent. And I'm happy to share more information about young plasma because this is like the one of the most advanced option in regenerative medicine. And we use that in a therapy called young plasma exchange, which is a procedure where we remove the old plasma, which is loaded with the senescent cell or zombie cell byproducts, a lot of inflammatory byproducts, um, toxins, microplastic, and so forth. And then we have the option of replacing that plasma that was removed with albumin or normal saline or with young plasma, which is like the best option.
Where are you getting the young plasma from? Are these people who are paid to donate for your center, or is it
So
a general?
this is through a private AABB accredited center, and they screen for qualified donors. And as I mentioned, it has to be 18 to 25 because that's kind of like the peak performance.
Yeah.
And then they get screened and they have to be qualified. And talking about the safety of the plasma product, I mean, as you know, we've been using plasma for over 100 years. And so, the safety is well established, meaning, for example, in 2021 to 2022, there was no reported death from plasma transfusion. In 2019, there was over 2 millions of units being transfused, and there was one preventable death. And so, using plasma, that is a long history and is well established. But what's new is that using young plasma, which now it turned out young plasma has a very rich combination of thousands of protein, hormones, cytokines, and particularly it's just loaded with small extracellular vesicle or exosome. And there's study that's shown that it is these exosome that carry the message to the aged cells in the recipient and pretty much to tell the aging cell to act younger again. And so it's just fascinating. Yeah.
Have you had young plasma exchange?
I sure did. Yeah, I have gone like 3 rounds of young plasma exchange, and I have had like a total of 5 liters in me.
Wow. And what did you notice from that?
Yeah. So definitely, almost immediately you just feel a sense of like mental clarity, like the cognitive function is insane,
Wow.
and the energy surge is definitely there. And then, just like the subtle aches and pains and um, when you look at the blood, the biomarkers, definitely um, blood sugar control improve, hemoglobin A1C would be reduced, inflammation markers across the board would be, lower. And then we also track for biological age. And and in terms of the heart, there's evidence of improve in left ventricular hypertrophy and improve in cardiac ejection fraction.
Yeah, wow. Wow.
Yeah, yeah, yeah.
Well, let's cover this last uh, tool on your list of um,
So
accessible tools in your toolkit. You've got sexual optimization on your website. What sort of, there's a
yeah,
P shot and an O shot. Do you want to talk about those briefly, Dr.
yeah.
Khan?
So P shot stand for pre-push shot, and so that's for men, and O shot stand for orgasm shot, and that's for women. But it's based on the same principle. Uh, P shot is where we have the option of using PRP or higher options such as young plasma, as we talk about, or exosome, and we inject that into the shaft of the penis, um, uh, in the cavernosum, and also directly into the gland penis, into the tip. And why? We do that to deliver growth factor and signaling agent to improve the health of the tissue in the erectile tissue, to improve microcirculation, to improve the health of the nerve, and therefore uh, that lead to uh, stronger erection, longer lasting erection, and a more satisfactory orgasm. For women, we inject biologic PRP and so forth into around the G spot and directly into the clitoris. And again, it will signal the body to make the tissue there healthier, leading to more lubrication, tighter feeling, and improved sensitivity. And uh, these are the procedure that I find really rewarding as a provider, because I make all of my patients aware that it's not your fault. There's nothing to be ashamed or embarrassed, because it's just part of life. And if you can do something, it's pretty minimally invasive. It's natural. It's safe, and it's life changing. Because when you improve sexual function, uh, it will definitely improve your self confidence, improve your relationship, right? And
Yeah,
you
it's
can be
huge.
a better husband, better
Yeah, yeah,
wife, better boss, better friend. Because when you feel good about yourself, and also healthy sexual health is equal to healthier, right? To
yeah,
better health. So I'm a big fan of that. And of course, we have to address all different topics relating to sexual health, meaning we discuss like hormone optimization. We need to fix that. We need to fix the lifestyle, uh, alcohol, sleep, substance abuse, medication, optimizing health, if you have uncontrolled diabetes, hypertension, all of that we need to address. And also, when somebody come in with ED, it's kind of like a prompt for me to screen for cardiovascular disease because
Of
it's
course.
earlier sign of that, right?
Yeah.
And so we look at your look at the patient's blood pressure, uh, look at the inflammation, look at blood sugar control and lipid panel,
Okay.
lipid profile. Yeah.
Look, this has been fantastic. For those listening, we've covered all sorts of stuff. We've talked about hormone replacement therapy. We've talked about IV minerals, um, vitamins. We've talked about NAD plus. We've covered a range of different peptides in a very superficial way, but there's obviously lots out there. We've talked about PRP, which is platelet enriched
Plasma.
injections. We've talked about young plasma exchange, which is something I've never heard of. And we've touched on sexual optimization. So I think we've covered a huge amount of stuff. If you're interested, go and look at Dr. Khanh Nguyen's website, which is the Austin Regenerative Therapy website. It's really, there's lots of information there. But what I'd like to do is thank you for sharing, and we'll wrap up now and maybe come back for those listening who want to know more. We'll come back and do a case study, and that case study might be a 60-odd-year-old male and how you might approach that. So thank you again, Dr. Khanh, for sharing.
Thank you. It's a
For
pleasure.
those listening, it's always a pleasure to share. I really hope you've got something valuable out of it. If you've got any queries or questions, drop us a note. And as always, I hope you live as well as possible for as long as possible. Take care and bye for now.